Dentists have always had a dilemma, whether to treat or to extract teeth. This short video will address that, some considerations that are now available that have not been available in years past. And also, patients need to be made aware of the limitations of dentures, but above all, they need to have the privilege and the opportunity of getting a total overview of what the prognosis is, what the finances are, and given treatment options. It's not up to us as dentists to deny patient treatment options. That is their decision to make. Now let's look at this brief video. Deciding whether to treat or extract teeth. The decision is the patient's decision to make, not the dentist's decision. Too often dentists present treatment plans that suit what they like to do or what they perceive as the best for the patient. However, I think the patient deserves the opportunity of hearing all the treatment options. And the first step is determine the overall prognosis, and then patients should be given all viable treatment options. Now let's talk about the overall prognosis. This is based on the periodontal status. And now we have so much more information on that based on the article published in the February 2014 issue of the Journal of Periodontology on the Miller-McIntyre Periodontal Prognostic Index. For the first time, we have an evidence-based, statistically validated, quantitative study that is very accurate that helps us determine the periodontal prognosis. And in that study, teeth that were lost during active treatment had a score of an 8.68. Now that doesn't mean a tooth with a score of an 8.68 cannot have a good prognosis, but when you have an overall prognosis of all the teeth in the mouth in the 8, 9, 10 millimeter range, certainly it would be more practical, I think, to do extractions on that. Caries is always a bugaboo, and certainly with meth mouth now, we have a very difficult caries situation to deal with. We're talking about root caries, caries within the furcation, and things like that. So teeth can be non-restorable because of caries. Aesthetics is always a problem. Not a problem, but always a consideration. And perhaps some orthodontics could be done. Perhaps some veneers could be done on anterior teeth. And certainly in a younger patient, these treatment options should be offered rather than extraction and a denture. Finances, obviously, that is a consideration, and time considerations. For instance, you may offer a patient in their 20s an orthodontic, restorative, periodontal treatment plan. However, an 80-year-old may not be interested in the time necessary to have the orthodontics done, and so this boils down to common sense. And certainly common sense is an encompassing factor on that. Considerations. Tooth is non-restorable because of caries. Number 2, overall periodontal prognosis, which we've discussed. Number 3, mobility from periodontal loss. And I'm not talking about a simple class 3 mobility. I'm talking about a tooth that's just wallowing in granulation tissue. Because mobility can be treated significantly, as you will find out in studying the other tapes on the Miller-McIntyre periodontal prognosis. Severe malpositioned teeth. Let's say you're missing a lower second molar and the upper second molar has extruded down where it's actually touching the ridge. Certainly that is so malposed that you'd want to take that out. And again, that comes under the category of, I think, common sense. To simplify the restorative treatment plan, perhaps you have a tooth that is severely malposed, gross caries, and would require endodontic therapy to do, then simplifying the treatment plan would be to extract that single tooth. And I keep coming back to common sense, common sense, common sense. Limitation of dentures. Patient will continue to lose bone. This is very significant in a patient in their 20s and 30s who are getting a denture, because after wearing a denture for decades, that denture is going to loosen up, and the new denture that's made will not be as retentive as the one they got in their 20s. Decreased chewing efficiency. Studies show that a denture is only about 20% efficient when compared with natural teeth. And with all that acrylic in the mouth, especially in the palate, you're going to have altered taste. And then with acrylic going across the palate and the flanges going down in the lingual on a lower denture, you're going to have altered speech, and the patient is going to talk somewhat like this, and it's very obvious that they're wearing dentures. The inability to bite foods and to chew things that are very important to them. They will not be able to bite a carrot. They will not be able to bite a sandwich. They'll not be able to bite and chew steak. And chewing steak is a big deal to us men, and so therefore patients need to be made aware of that. And finally, the psychological impact. We're taking out a body part that's right in the middle of the face that deals with speech and personality and all that. So losing that body part is a whole lot different than getting glasses or getting a hearing aid. A lot of patients are very, very negatively impacted by the thought of losing their teeth. So therefore, the psychological impact needs to be emphasized to the patient.